Psychedelics are psychoactive substances that produce changes in perception, mood, and cognition. Once stigmatized and restricted, these compounds are now at the center of a research renaissance, revealing their potential for treating challenging mental health conditions. In medicine, psychedelics are not recreational drugs. They're precision tools that, when used in clinical settings, can catalyze lasting psychological healing. This shift comes at a crucial time, as current treatments for depression and PTSD often fall short, leaving many in chronic distress. Unlike daily medications, psychedelics can facilitate deep therapeutic breakthroughs in just one or a few sessions, especially when paired with psychotherapy. The word psychedelic means mind manifesting, reflecting their ability to unlock profound insights and emotional release. Guided by trained therapists, these experiences help patients re-examine their lives and break free from rigid thought patterns. Clinical use involves careful screening, precise dosing, and a supportive environment, followed by integration sessions to translate insights into real-life change. This structured, supervised approach is key to harnessing the healing power of psychedelics while minimizing risks. As research advances, psychedelics may redefine our approach to mental wellness. To understand psychedelics, we need to look at the brain's communication network, billions of neurons using neurotransmitters like serotonin. Classic psychedelics such as psilocybin, LSD, and DMT closely resemble serotonin, allowing them to activate the brain's 5-HT2A receptors. This triggers profound changes in consciousness, including a temporary decrease in the default mode network, or DMN, which is linked to self-focused negative thought patterns. By quieting the DMN, psychedelics disrupt entrenched thinking and open the mind to new perspectives. At the same time, they boost communication between brain regions that don't usually interact, creating a hyper-connected, flexible state. This is the basis for vivid sensory experiences, synesthesia, and novel insights. Most importantly, psychedelics promote neuroplasticity, the brain's ability to form new connections. This window of plasticity extends beyond the session, making the brain more receptive to learning healthier patterns. Studies show psychedelics stimulate the growth of new dendrites and synapses, supporting lasting change. Therapy during this period helps solidify new pathways, the result of brain primed for transformation. Psychedelic-assisted therapy is showing remarkable results for major depression, especially when other treatments have failed. Studies from Johns Hopkins and Imperial College London found that psilocybin can rapidly reduce depressive symptoms after just 1 or 2 sessions. For PTSD, MDMA is leading the way, creating emotional openness and reduced fear, allowing patients to process trauma safely with a therapist. Clinical trials show many participants no longer meet PTSD criteria after MDMA-assisted therapy, prompting the FDA to consider it a breakthrough treatment. Psychedelics are also helping those with end-of-life anxiety, especially cancer patients, by reducing fear and increasing acceptance through profound, meaningful experiences. These therapies offer hope for those facing the toughest mental health challenges. The results are so promising that they're reshaping the future of psychiatric care. Psychedelics may soon become vital tools for healing where conventional treatments fall short. 3 compounds are at the forefront of psychedelic therapy: psilocybin, MDMA, and ketamine. Psilocybin, found in magic mushrooms, is now synthesized for clinical use and shows strong effects against depression, anxiety, and addiction by increasing brain connectivity. MDMA, known for fostering empathy and trust, is ideal for trauma therapy, especially PTSD, by reducing fear and enhancing emotional openness. Unlike classic psychedelics, MDMA doesn't cause strong hallucinations but creates a safe space for processing difficult memories. Ketamine, originally an anesthetic, works differently. By blocking NMDA receptors and boosting glutamate, it rapidly relieves depression and promotes new synapse growth. Ketamine is already FDA approved for depression in the form of esketamine nasal spray, making it the most accessible of the 3. Psilocybin and MDMA remain federally restricted in the US, but clinical trials are expanding and legal frameworks are evolving. Each compound offers a unique pathway to healing, broadening the options for mental health treatment. As research grows, so does access to these transformative therapies. The landscape is changing fast. Legal access to psychedelics remains the biggest barrier, but change is underway. While psilocybin and MDMA are federally classified as Schedule I substances, research is accelerating thanks to shifting attitudes at the FDA and DEA. States like Oregon and Colorado have pioneered legal, supervised psilocybin therapy, creating regulated centers for safe use. Cities such as Denver, Oakland, and Seattle have decriminalized entheogenic plants, reducing the risk of arrest for personal use. Internationally, countries like Canada, Switzerland, and Australia are opening special access programs or rescheduling psychedelics for medical use. Australia now allows psychiatrists to prescribe psilocybin and MDMA for treatment-resistant depression and PTSD. These changes reflect a global shift toward public health and harm reduction. The legal landscape is a patchwork, but momentum is building for broader access. The future of psychedelic therapy is becoming more accessible step by step. The future of psychedelics in mental health hinges on science, legislation, and education. The FDA may soon approve MDMA-assisted therapy for PTSD, a historic milestone that could pave the way for other psychedelics. Psilocybin is close behind, with late-stage trials for depression showing strong results. As these therapies gain approval, training and certifying therapists will be crucial to ensure safety and effectiveness. Equitable access is another challenge. Current treatments are expensive and time-intensive, risking exclusivity for the wealthy. Advocates are working to make care affordable, exploring insurance coverage and group therapy models. Psychedelics represent not just new drugs, but a new paradigm for healing, one that empowers individuals and leverages the brain's capacity for change. The journey ahead requires diligence and open-mindedness, but the potential to reduce suffering is immense. With careful exploration, psychedelics could transform mental health care into something more effective, personalized, and humane. We stand at the threshold of a new era in psychiatric treatment.